Welcome friends. We are revising homeopathic remedy Magnesia phosphorica, and here we are dealing with part 8E MCQ review for practice. And the text is especially developed in a short case format, and the bed references as usual are taken up from Ellen's keynote. I am Dr. V.K. Chauhan, homeopathic physician. So let us go to the first MCQ. It is related to dysmenorrhea, and the case tells us a 28-year-old woman presents with excruciating menstrual cramps that makes her bend forwards and clutch her abdomen. She feels relieved only when she applies a hot water bottle and presses firmly on her belly. The pain is spasmodic, shooting and radiates to her thighs. She dreads the onset of her menses due to intensity of pain. So what is the most characteristic modality is in this case? A. The pain better from bending forward, clutching her abdomen. B. Pain better from heat and pressure. C. Pain spasmodic and shooting. And D stands for all of the above. The answer is all of the above. And let us recall all are the classical Mhag keynotes. We go to the second MCQ, same case study, which remedy is closest differential but has pain relieved by hard pressure, not necessarily by heat. The variable A tells us colocynth, variable B stands for pulsatilla, and C tells us about sepia, and D stands here for leucocysts. The answer is a colocynth, and let us recall similar cramping but key modality is better from hard pressure, and here colocynth comes in. Let us go to the case study 2. It is related to sciatica with cramping pains. A 45-year-old man complains of sharp electric-like pain running down his right thigh worsened by the cold weather. He finds temporary relief by applying a heating pad and gently massaging the area. The pain is worse at night, making sleep difficult. So first question comes here. Which feature most strongly suggests magnesia phos over other sciatica remedies? A variable tells us pain worse from cold weather. B. Neuralgia better from applying heat. C. Pain relieved by massaging. And D. All of the above. The answer is D. All of the above. And if you recall, Mhag sciatica is neuralgic and heat responsive. Nephelium has numbness, bryonia avoids movements. Same case study, we go to the second question. What would be the best potency for acute flare-ups? A. Magphos 6x in warm water. B. Magphos 1 million single dose. C. Magphos mother tincture. And D is Magphos 200C dry dose. Answer is Magphos 6x in warm water. Please recall, frequent low potency does work well for acute pain. Now we come to the case study 3, infantile colic. A 4-month-old baby screams intermittently, drawing legs up to the abdomen during episode. The parents notice that the baby calms down slightly when held belly down on a warm towel. Passing gas provides minor relief. The question number 1 comes. Which remedy matches this presentation? A. Chamomilla. which is angry and inconsolable. B. Cholesynthesis, better from heart pressure. C is Magnesia phosphorica, cramps, relieved by warmth. And D is Lycopodium, bloating 4 to 8 p.m. aggravation. The answer is C. Magnesia phosphorica. And let us recall infantile colic with cramping pains relieved by warmth and bending double is the important keynote symptom here. Now let us go to the same case study, and here comes up second question. How would you differentiate Phos from chamomilla in colic? So here A variable tells us chamomilla is better from being carried and worse by heat. B. Phos babies are cheerful in between the spasms. C. Again, chamomilla babies are inconsolable and angry. And D. All of the above. So, answer is all of the above. Please recall chamomilla has rage plus red cheeks plus and Phos has spasms and relief from warmth. Let us go to the case study 4 where we are dealing with writer's cramp. A 32-year-old writer develops painful hand cramps while typing, forcing her to stop work. She soaks her hand in warm water for relief. The cramps are spasmodic with no weakness or numbness. Now, the question number one is what is the most likely remedy? A. Causticum, where you find weakness and paralysis. B. Gelsemium, where you will find tremors and anticipatory anxiety. C is here Magnesia Phos, where you will find cramps which are better by heat. And D stands for Hypericum, where nerve injury pain is most important. Now the answer is C, the Magnesia Phos. And we concluded for Magnesia Phos, where the occupational cramps with heat modality is marked feature. Now we go to the second question in the same case study. Which adjuvant therapy aligns with McPhos action? A. Ice pack. B. Magnesium supplements. C. Stretching without warmth. And D. Avoiding hydration. So our answer is B. Magnesium supplements. Please remember, McPhos is a biochemical remedy and magnesium deficiency can contribute to cramps, so we can supplement magnesium. Now we have the case study 5. Postpartum after pains is the theme. The case is a new mother experiences severe uterine cramps while breastfeeding, described as labor-like. She uses a heating pad and finds pressing her fist into her abdomen helpful. Now the question one comes, why is Magphos superior to belladonna here? Belladonna has throbbing pains, not cramps. B. Magphos matches the spasmodic plus heat relieved pain. C is belladonna is for fever with redness. And D is all of the above. The answer is all of the above. And please recall belladonna suits inflammatory pains and Magphos fits cramping pains as a keynote modality. Friends, thank you very much for watching and patient listening. Sharing is caring.